Deviations of the head and clinical management in cattle. The posture is the relation of the extremities, such as the head, neck and legs, of the fetus to the trunk. They should be flexed during pregnancy and extended during birth. The possible deviations of the head are lateral deviation, downward deviation, or upward deviation. For the lateral deviation of the head, the cause is when the cervix does not dilate or there's an abnormal traction. In calves, it's way more common on the left side. For the diagnosis, you'll see one forelimb more caudal than the other. For the prognosis, in calves and sheep it's good, but in foals it's bad. If it's non-bloody, you can help get the calf out with your hand, a mandibular snare, a Gagne loop, or eye hooks. But if it's bloody, you can do a partial fetotomy or a C-section if the calf is still alive. For downward deviation of the head, vertex, which is seen on the left, is when the head cannot enter the pelvic cavity, but the legs are already in the pelvic cavity. Or breast head, which is seen here, when the head is literally touching the breast. It can be misdiagnosed as a lateral deviation. The cause of both of these is when the cervix does not dilate, or there's abnormal tractions. These occur mostly in lambs, and the prognosis, it's good. For breast head, it can vary. The non-bloody method is using your hand, push the head back into the uterus, and use the orbit and muzzle to try and lift the head. You might need to flex one of the limbs and push it back in to have more room. You can also use eye hooks when the head is in the breast head posture. And the bloody method is using a partial fetotomy when you cut off the head and the forelimb, or do a C-section if the calf's still alive. And for upward head deviation, this is when the cervix does not dilate and there's abnormal tractions. The prognosis is bad. However, it happens mostly in foals. It's quite rare. The non-bloody method is getting your hand and trying to push the head laterally. Or just do a partial fetotomy, cut off the head, or do a C-section.